All right, let's talk about something that every single one of us goes through. What on earth are you supposed to eat when you're sick? Because it turns out pretty much everything we know about healthy eating gets thrown right out the window when our body is in the middle of a fight.
I mean, we've all been there, right? You're running a fever, you feel weak, and honestly, the thought of eating anything at all just sounds awful. You might try to choke down something good for you, but your body is just not having it.
Well, guess what? That feeling is not just in your head. It's a powerful biological signal. It's your body literally telling you that the everyday, peacetime nutritional plan has been scrapped. We're in emergency mode now, and the new plan is all about survival and repair.
Okay, so let's really get into this. First, we've got to understand why. Why do the rules of the game change so completely when we get sick?
Think about it like you have two different blueprints for your body. When you're healthy, you're using the maintenance blueprint. It's all about balance, keeping things running smoothly. But when you're sick, whoa, your body pulls out the emergency repair blueprint. The new goal is just replenishment and repair. Forget maintenance, we're rebuilding after a storm.
And this is where the trouble starts, because you're suddenly fighting a war on two fronts. On one side, you're not taking in enough nutrients. And on the other, your body is burning through and losing the nutrients it does have way faster than normal. It is the perfect storm for malnutrition.
So let's tackle that first front, taking in less food. The medical term for losing your appetite is anorexia, and it's a super common side effect of infections and inflammation. Now, for patients who are so sick they have to rely on IV drips, it is absolutely crucial that those drips are actually providing the right nutrition to begin with.
Now for that second front, which is honestly just as scary, losing more nutrients. Anytime your body loses fluid, you're losing vital nutrients along with it. Think about it. That horrible bout of diarrhea, it's not just uncomfortable, it's actively draining your body of zinc. For patients with severe burns, they're losing massive amounts of water-soluble vitamins. And of course, any significant blood loss can easily lead to an iron deficiency.
So with this two-front war raging, how in the world are we supposed to think about the basic building blocks of our diet? Carbs, proteins, and fats, because their jobs totally shift when we're sick.
Yeah, when your body is under that much stress, the strategy isn't just eat more or eat less. It's way more nuanced. The type of nutrient you're getting becomes incredibly important.
Let's start with carbs. They're the body's main fuel source. High-quality carbs, like the ones from whole grains, are consistently shown to lower the risk of big killers like heart disease, stroke, and cancer. And the fiber from fruits and vegetables? It's essential for a healthy gut, and it helps keep your blood sugar and cholesterol in check. This is the premium fuel your body needs.
Now, protein, this one's a little tricky. It's what I like to call a paradox. It is absolutely essential for rebuilding your body, but where you get that protein from matters a lot. There's a big risk, but also a huge reward.
Let's talk about the risk first. Red and processed meats have been linked to some pretty serious stuff, including a higher risk of colorectal cancer. They can also put a strain on your kidneys and liver, and even mess with your body's ability to control its blood sugar.
But here's the reward side of that paradox. Getting enough of the right kind of protein is completely non-negotiable. It is critical for fighting off muscle loss as we get older, keeping our bones strong, and it's the absolute foundation for rebuilding tissue after something devastating like a severe burn or major trauma.
Okay, and what about fats? Well, here, the science is way more black and white. It really all points in one direction. We need to be favoring the unsaturated fats, the MUFAs and PUFAs, and really limit the saturated and trans fats.
And the reason why is pretty clear. These so-called good fats are just workhorses. They can lower your risk of heart disease, help control your blood sugar, and they actually improve your cholesterol, lowering the bad stuff and raising the good. They even play a role in supporting your mood and keeping your nerves healthy. They're just critical players.
Okay, this brings us to a really important idea, especially in a severe illness. It's not just what you're eating, it's when you're eating it. The timing can literally be the difference between helping your body and hurting it.
For someone who's critically ill, this idea is everything. The entire nutritional game plan is dictated by the phase of their illness. You can't just flood a body in crisis with nutrients and hope for the best. You have to be strategic.
So here's how that modern strategy looks. Step 1, and this is the big one, stabilize the patient first. That means fixing hydration, oxygen levels, and any other metabolic chaos before you even think about aggressive feeding. Step 2, start slow with a very low calorie intake. Then step 3, you slowly, carefully increase the nutrition as the patient can handle it. That heavy-duty rebuilding, that's saved for step 4, the recovery phase, once the immediate danger is over.
And trust me, there is a very, very good reason for being this careful. Rushing things can be disastrous. Feeding someone too aggressively too soon can cause nausea and vomiting, which can lead to something called aspiration pneumonia, a really serious lung infection. It can also spike their blood sugar and just make the body's overall instability even worse.
Okay, and finally, there's one last crucial piece to this whole puzzle, and it's something that often gets overlooked: the hidden risk of how medications and nutrients can interact.
And I really want to emphasize how serious this is. The source material puts it bluntly, saying that these interactions can cause, and I quote, serious and sometimes fatal complications. This is not a minor detail. This is a life or death aspect of patient care.
So how does this even happen? Well, to put it simply, some drugs can interfere with every single step of a nutrient's journey through your body. They can block absorption of vitamins in your gut. They can change how you metabolize fats, and they can make you excrete essential minerals way too fast. It just adds a whole other layer of complexity.
So if you take one thing away from all this, let it be this: nutrition during an illness isn't a static rulebook. It is a dynamic, fluid response to what your body is screaming that it needs in that exact moment. The blueprint is always, always changing.
And really, that leaves us with one final thought. Our bodies are incredibly smart. They send us powerful signals, especially when we're vulnerable. The real question is, are we actually listening to what our body truly needs right when it needs it the most?